Izinyane leSilo uNhlanganiso kaZwelithini, Prince Nhlanganiso Zulu, and leading health NGO Isibaya samadoda are hosting a double protection event for men with a focus on COVID-19 vaccination and medical male circumcision. Both traditional leadership and the Department of Health will be coming together to promote men's health. We are joined once again by our reporter Nozintombi Miya, who is in Vosloorus, Ekurhuleni, where the event is taking place. Nozintombi had quite an interesting discussion earlier on about the role of traditional leadership and why this event is so important. So tell us now the role of government. I believe you are standing with the Deputy Health Minister, Dr. Nhlanganiso.
You're quite right. Thank you so much, Tsepi. You know, we still are here at the Vosloorus Hospital, and this event is about challenging stereotypes and dealing with preconceptions and with stigma. And you know, one of the issues with dealing with stigma is trying to get a lot of men to come and you know, test for HIV and also to get the jab. So what we're going to do for you now, I'm just going to ask my camera colleague Sandile to just sort of give you a sense of where we are. I'm sitting here in the tent with these lovely ladies behind me who are the nurses at the Isibaya samadoda NGO, as well as Right to Care. And what they're going to do is they're going to be administering the second jab that I'm supposed to receive of the Pfizer vaccine. And I have this lovely lady whose name is Andisiwe, who's going to be administering my second jab. Thank you so much for joining me, Andisiwe. You're going to be administering my second jab. This must be exciting for you.
Very, very, very exciting. Thank you.
All right, so just take us through the process. A little bit earlier on, they filled in all my details. They took my name, my ID, and all the rest of my documents. Why was it important for you to take these documents, this information, and note it down for the second jab?
Okay, you see, when you come for the second jab, we really must check on the system whether your name appears or not. Because when you come for the second jab, we verify your information, then we register you, then we give you a first jab. So for the second time, we must ensure that your information is still correct and is still there. Yeah.
All right, so we're going to let you continue with administering the jab. If you can just sort of explain to us what needs to happen.
Okay, what I just did now, I put your name on my stats because I need to give it to my bosses, and also I'll prepare your card that you can take with you when you go home. Then I'll just sanitize myself now and administer your second jab.
All right, so while Andisiwe is busy doing that, and she's going to be administering the jab, we're going to be speaking to the Deputy Health Minister, Dr. Ndlomo, about challenging stigma. And, you know, being able to vaccinate on air and to show South Africans how important it is to vaccinate, to start stemming the tide against the COVID. And because we know that the fourth wave of COVID is coming within the next couple of weeks, how important is it to encourage men to come and vaccinate?
Thank you very much. We are quite encouraged by you coming in, my dear sister, to receive your second vaccination live here at this Vosloorus hostel, where we are gathered with men to encourage them, among other things. But the main priority was getting Prince Nhlanganiso to focus on the main medical circumcision. But however, this pandemic that we face of COVID-19 always encourage South Africans, especially men, because they have been lagging behind, to come forward and vaccinate. And therefore, this demonstration that we are going to do live, I'm glad, because a couple of these tents around here, we see men also lining up to get the vaccination.
All right. So, Deputy Minister, as we're speaking, we can see that Andisiwe is administering the injection for the second vaccination. And you were saying now, just before we got interrupted, how important it is for men to come and get their vaccination.
But not only just for men, but for the nation. Just last week, the minister was actually indicating to us that we are sitting at about 63% of the elderly senior citizens, 60 years and above, who are already vaccinated. We actually got some other philanthropists who assisted us by setting vouchers so that the 60-year-old and above, if they vaccinate in the month of November, they can get a 100 Rand voucher. So we're encouraging so that if then they use that only little money, because not all our clinics are near the place where people live. So you would probably use 10 Rand for a taxi fare. If you do that, we will then getting some people who are supporting us with the 100 Rand reward for that. So we want to push, as you are rightly putting it, we don't know when the fourth wave is coming in, likely at the beginning of this year, beginning of next year. So if it comes, and most of us are vaccinated, we would have done very well. So we really encourage men in particular, because men are really generally are not a health-seeking behavior type of species. They always say, no, my wife has gone to it, therefore it's fine. No. This is about all of us going into it. Yes.
So, this event is so important, especially in an area like this in Vosseras, where a lot of the men in Dunas here are the custodians, the doyens of young masculinity and old masculinity. So their say is very important to young people. So how important is it to start influencing their thoughts, their behaviors, and their patterns in encouraging young people and their peers to come and ensure that they're fully tested for HIV, that they have fully vaccinated, they've done their civil duty by fully vaccinating, and ensuring that they encourage safe circumcision.
I was hoping that after this you are going to go and grab Nduna Undwandwe, because Nduna Undwandwe is in charge of all Izinduna in Gauteng from KwaZulu-Natal. Therefore, getting him to vaccinate or getting him to give a positive message will necessarily influence all of Izinduna, and therefore, because of the respect that we give to our monarch, people will suddenly respect that word that comes from the main Induna as coming in from His Majesty himself. So we really would want to, I hope we'll take this advantage to grab these men who are here, leadership office in Induna here, and therefore if you see them vaccinated, it will like cascade the information right down to all of other people here.
Certainly, Dr. Domo, I've just vaccinated, fully vaxxed, which is amazing. We are heading towards the fourth wave, but if we don't get sufficient people uptaking with their vaccination, we could see ourselves, having to shut down even further or having further restrictions. How concerned are you with the uptake of vaccinations in Gauteng, in the nation, with people ensuring that they're fully vaccinated before we go into the fourth wave? How concerned are you, and what are you hoping to do to try and increase those numbers?
All these non-monetary incentives that we are actually doing together with our partners are to motivate, to mobilize, and request our South Africans take this opportunity. The vaccine is free, and I look at you when you are getting up. You didn't really even. So even the little pain that you get cannot be compared to the success and the reward of being vaccinated. Therefore, we really request, as a department, we really would do everything it takes. That is why we would like to be invited, as the department is here, whenever there are certain occasions, we come in there and vaccinate. We go all over, wherever people say, are you vaccinated? Yes, 20 are vaccinated and the other 30 are not. So we want to push our figures very hard. And the minister was actually saying, if we can just get to over 60%, at least by December, we'll really rest and say, this fourth wave will come, but will not kill too many people. So we really want to encourage, because we now know even if we get one jab, but you must complete your jab. I'm glad you did. Even with one jab, we are almost 80% protected against this COVID-19, as we are getting from the experts. So we really encourage them, and thanks for this opportunity to grab us wherever we are to talk about this, because that is what it actually means. Please, we want to open up our economy. We want to go back to sports activities. You see in other countries, people are now enjoying going to stadia. That will also only happen if you are vaccinated and we think we are safe as a country.
Thank you so much, Deputy Health Minister. Just giving us more clarity about what the event is about and why the event is so important. And just to say thank you so much to Andy Siwe, who administered the jab. Are you excited that you administered the jab on air live? Yay! Right. Thank you so much. And to see where Tsepiso, one more South African fully vaccinated now, encouraging other South Africans to vaccinated so we can really stem the tide against, the fourth wave of COVID. All the NGOs here at the Phosphorus Hostel, doing their part to encourage the Indunas, the residents here, to make sure that they do their part. Come and get vaccinated, come and get tested for HIV/AIDS, and ensure that they encourage young people to, young men to safely circumcise. And, we heard from the Deputy Minister of Health here saying that they're hoping to get to about 60% of vaccinated South Africans just before the fourth wave, which will be able to really buffer the country against, the stringent levels that we've seen, the lockdown levels that we've seen. We will be giving you more updates. We will be speaking to some of the Indunas to also get their thoughts around, how they feel about the program, this Isibaya samadoda, as well as Right to Care, the different NGOs that are here encouraging all the different people in this particular area of Phosphorus, at the Phosphorus Hostel, to come through and really make sure that they get their jobs and they get tested. Tsepiso, with that, it's back to you in the studio.
Before I let you go, I would like to ask, so by the way, I'm glad you got your second jab. Ekasilami Phosphorus, by the way, that's where I'm from. So tell me, how difficult has it been having this conversation? Particularly, we know when we talk about male circumcision, you're talking about a hostel, and I heard Dr. Dhlomo there say, go grab a few men, and I mean, that must be quite a daunting task. But tell me, what has the conversation been like? Have those barriers broken down, those stigmas of talking to women particularly, you're surrounded by women, about this particular subject?
Yeah. You're quite right, Tsepiso. A little bit earlier, I spoke to one of the residents here, a young woman who's a resident here, and she said that it is extremely difficult. It's an extremely patriarchal environment, firstly. So talking about issues that have got to do with men's health, personal issues, is always quite a tricky subject, and it's always best to approach it with the utmost respect and the utmost dignity and professionalism when it comes to that. So, the issue of stigma, the issue of breaking stigma, the issue of other people who see you on air, live, doing something as natural as getting the injection, and it being such a seamless process without any complications or anything, also helps to encourage them. So this is the point at which we as the media are coming to the Indunas, are coming to the communities and saying, we understand the reluctance, the stigma that's involved with being seen to be taking care of your health as a man, as an Indoda. But that shouldn't negate against you actively taking care of yourself, because in taking care of yourself as a man, you're taking care of yourself as the head of the house, as the head of a community, and you're encouraging those younger than you, your peers, to come forward and also do what they can to protect themselves and to protect their community, in ensuring that they know what their HIV status is. They're fully circumcised, and they know, what their health status is with regards to that, and ensuring, that they're fully vaccinated and they understand what the consequences are of vaccinating, and they understand the importance of vaccinating. And if they choose not to vaccinate, they also understand fully the importance of not vaccinating and the impact, the knock-on effect, that could have on the country. You understand that the country, our health sector and the presidency, what they've done is they've said to try and incur herd immunities, to try and ensure that as many people are as fully vaccinated. But people are not forced to vaccinate, and people have said that they wouldn't vaccinate because they don't feel comfortable with it, or they feel that they have sufficient immunity against the COVID virus. But in whichever choice you choose, to vaccinate or not to vaccinate, we need to be having the conversation that people need to understand the consequences of their choices, of their actions, and how that is going to impact not just on themselves as individuals, but their communities, the country, the province, and the entire country, and ensuring that we try and move away from the severe restrictions that we've seen happening. And as the Deputy Minister rightly said, reopening up stadiums, reopening up the country into us having some sort of life as normal. to circle back to answering your question, it's about having the conversations in an absolutely respectful way to those people who may not traditionally be open to having those kind of conversations that are very difficult to have. They are complicated conversations. They are sometimes considered culturally taboo for women to be talking about it, but it is so important and so critical for the health of all South Africans for us to be having respectful, open, professional conversations about these issues.
All right, thank you very much, Nozintombi Miya, my colleague who is out there in Foxlorus.